have NGOs who support the program, but in terms of cases, they are recording less cases than expected cases. So we are not sure if we are testing the good people, or we are just missed the contact tracing.
Oh.
Yes.
Wow.
Are you able to get somebody to talk to us? Maybe from one of the NGOs?
From one of the NGOs, yes, but the problem is they are not good in English. They are not in a position to talk. So unless they have someone to translate, and yeah, they need the translation. Yes.
Or they'll be speaking in French or Swahili?
They speak French.
French, eh?
Yes.
Okay.
Yeah.
Yeah.
Yeah. I mean, we can, or even getting an article together.
Yes, we can. Yes, we can. We can even in our organization, Foundation Africa Telema, we can have an article together. Yes.
Yeah, and Mwema, what
Yeah.
about the Ebola situation? How did you find it on the ground with regards to the Ebola outbreak and the fight against COVID-19 at the same time?
The Ebola outbreaks, we have medics people who are they're still working on Ebola outbreak, because we still have Ebola outbreak, and they are in another site. I will try if I can talk to my supervisor to put me in contact with those people, so that we can have discussion about that team. It was a team which was managing Ebola outbreak.
Yeah, maybe in the team you could have someone from the international. I mean, in an international organization, so they could be bilingual. Like they could have talk in French and English. Maybe you could look for some. Yeah.
Yes.
Yeah, that would be interesting. Yeah. So, Dr. Ayah, we just started with the updates with Mwema. So far, we have discussed a number of. I was updating Mwema on what is happening in Kenya. For example, we are recording very high number of COVID-19 cases in a day. For example, today we had 1,185 cases, and we out of 9,000 tests. So, which translates to a positivity rate of 12%. And I think yesterday it was a positive. Yeah.
I've just seen that the number of cases in October now exceeds July.
Oh, the total number of
15,200 cases. Compared to 14,300 in July 2020.
Yeah, and that's in addition to the number of deaths. So still the number of deaths have not increased in relation to the number of cases, because we have been reporting a daily number of deaths between 5 to 20 people. So like even today we had 16 deaths, but the number of cases have gone higher. So like what you had.
No, the fatality rate is lower.
Yeah, the fatality rate is lower.
It's 1.77. The fatality rate in September was higher because the tests were lower.
Okay.
Yeah, so they were not doing the tests.
Yeah.
So yeah, but in terms of the actual.
Yeah. So that brings in the other point you had written about the undercounting of the number of deaths. And this is the case you found us discussing Mwema's experience when he was traveling to DRC. So Mwema went to Kenyatta for a COVID-19 test, but I think he was told it could take a week for him to get the results. So but when he went to Aga Khan, he got the results within 24 hours. And if you relate that now to my experience in the clinical setup, we are losing so many patients awaiting COVID-19 results and even awaiting COVID-19 tests. So like this is like in this week alone, we have lost 4 people in my ICU whom we had suspected of having COVID, but the tests had not been done. Yeah. So the undercounting of the deaths and the disparity in terms of testing, yeah, it's a big issue that would need to be picked up. Yeah.
I wish you'd write something like that.
But of course, it will have to be anecdotal.
No, just about the theory of it.
Yeah.
Is about the turnaround time for tests.
Oh yes, the turnaround time for tests.
Yes, that's just the theory of it, saying that you see, if you take this thing about saying 14 people died today. Okay, so this was a controversy even in the UK, where they say 14 people died today. We are reporting 14 COVID deaths today. We're not saying 14 people died today. You see, so you have to look at the wording very carefully in terms of what is that. So it's just a definitional issue. So if I died 10 days ago,
and then your results came a week later.
Back,
yeah.
Yes. So what does that tell me? What are you telling the community?
Yeah.
Well, what do you want us to do with this information? You see, as we have come, we've taken our body, we've gone through burial, etc., etc. I came from a house where I came with, I had COVID. Then it takes a week to do the testing, which means that in that week, there's no quarantine in that house, there's no contact tracing, there's no nothing.
I see how one would structure that article. Yes. So the implication of the delayed reporting of the actual deaths from COVID. Yeah.
So actually, if you don't turn around a test in 24 hours,
yes,
for contact tracing, it becomes null and void, because the period of contact tracing is 24 to 48 hours.
Yeah. Sure.
So if it takes more than 2-3 days, and that's what's happening, if you see the way they bunch tests, it means that they're bunching them, eh?
Yeah.
So it means that actually it's not for contact tracing purposes. Yeah, it's just being done as a pro forma. So even when they report 10 deaths, it doesn't mean anything. Those deaths could be of a week ago.
Or even 2 weeks ago. It's possible, even 2 weeks. Yeah. So when we are told 16 people are reported to have died today because of COVID, so we could be then, if that is an information that was supposed to be given, for example, 7 days ago, so we could be having 50 deaths today, actual 50 deaths today.
Yes.
Yeah. Yeah. That is what it could mean. Yeah. Yeah, that's an issue I can pick up and write something about from next week.
Yeah, so it's just writing about it's actually revising, going back to the theory of what is the point of testing?
Yeah.
Yeah, 93% of people are asymptomatic. What is the point of testing? You are testing so that you protect others.
Yes.
So now we want to only test the 7%. The symptomatic.
Yeah.
Okay, so the 93% are busy spreading it.
Sure.
So whenever one of the 7% walks forward, they get tested.
Yeah.
So actually, when they report 1,000 as being positive, okay, assuming that those are some of them are airport, what have you, travelers or whatever. The interesting figure now is the figure they're reporting of in home-based care. That means they had symptoms.
Yeah.
Okay.
Yeah.
Plus the ones who are in hospital. Okay. So that figure now starts to tell you.
Yeah.
So like for now, the figure for is about 5,000.
The figure for
5,500. There's 1,000 people in hospital.
Oh.
And 4,440 in home-based care.
Yeah, home-based care, and about that 5 in ICU.
Yeah, but the ICU are inside the admissions.
Yes. Oh, yeah. They're in the admissions.
Yeah. So this is a prevalence figure. It's not an incidence figure. You have to subtract to get the incidence figure.
Yeah.
So saying 5,500 people are in have symptoms. That is our 7%. So actually, at the moment, there are 80,000 people.
Yeah.
With COVID, according to that. Okay.
Yeah.
Based on our testing.
Based on our testing, yeah.
Yeah, based on our testing.
So we are missing
those two
figures. Missing the we are missing a lot more people with COVID-19 out there.
No, you don't know.
Yeah.
You don't know. You might say, well, that's if our testing is efficient. That's what it is.
Yeah.
You see what I mean? I mean, they've started giving that break. So if 80,000, so now you look and you say, what is the rate of spread? Can you remember that?
The rate of the spread.
Yeah, each person spreads how many?
Yeah, or the reproduction number 2.
Yeah,
it's like 2 to 3. Yeah.
Yeah, so these 80,000 people will give it to 250,000 people.
Yeah.
And this number is rising every day because the people being admitted are rising every day.
Yeah.
Yeah, so you can work it back in reverse in terms of how much, if this continues, how much pressure there will be on the hospitals.
On the hospitals, yeah.
Yeah. But the first thing is just to say, is to do that article about the
turnaround time on testing. And the point of testing, yeah.
Yes, that might be a good revision thing, and then to relate it,
Yeah. Wow. Okay. Yeah. So the other thing is, I think we were trying to discuss this with Mwema. So how can we explain the second wave? Because if you look at the graph, it's like now the numbers have started to climb. The cumulative numbers, the daily number of cases started to climb again. So we're starting to have like another curve following the initial one. So we thought that the reopening that was accompanied by political campaigns and everything, and
can you do a timeline and put that there?
No, that is what we would have to trace to find a timeline when this reopening was done and when we started having political campaigns. And a week or after 2 to 3 weeks, then we started having the rising number of cases. Yeah. So it will be good to have like a timeline on when the reopening was done and when we have begun to see the rise in the number of cases. Yeah.
I think that's not too difficult to do.
Yeah.
Because you just have to combine the story of the how does the virus replicate? Yeah, because you're looking, and so you have an event, and then you say this event occurred on, say, 20th.
Yeah.
And there was such and such a crowd. Right?
Yeah.
And then look, it takes, how long does it take for the virus to start to spread? What's the incubation period? It's like 2 days.
The incubation period is 5 to 6 days, but it can
5 days on average.
Yeah, it can go up to 14 days in some cases, but 5 to 6 days, that is the average.
Okay, so let us say 5 days. So you have an event. So you look wherever there's a little burst of activity.
Yeah.
And you trace back and see, was there an event that happened 5 to 14 days before?
Okay, yeah.
In each of these counties.
Yeah, sure. That way we can trace the event that could explain the resurgence of the number of cases. Yeah,
yes.
Sure.
Yes, yeah. So that I think is not too hard. We can do that collectively. What we can do now, I mean, that's an interesting one.
Yeah.
Is you see, do you have a, well, I can just generate the
graph.
Share the thing for October.
Okay.
The graphs.
Yeah.
Then we create a spreadsheet.
Yeah.
By date. So it says 20th October. Like say Laikipia. So Laikipia I know because Laikipia I got some calls. They had an event early on. That one I know. Yeah. So that's like yeah. So you can look at something like that and say, so what has happened in that is increasing this thing?
Yeah.
But the only catch is that the testing is erratic.
Yeah.
They're not turning around. They're not turning around in 2 days, 3 days. So sometimes it's like, you may look at something like I mean, take an example, Wasengishu. Today it's 51. Yesterday was 103, then 50, 68. Then no cases on 26th. You see?
So if no cases on 26, so most likely they didn't test on 26.
Yes, they call, and then and then 2 days early on 23rd there was 181. So the trend, if you did a 7, yeah. So when you look for specific whatevers, you can see definitely it is rising.
Yeah.
Yeah. Nakuru the same.
Yeah.
Yeah, the report 120 one day, then 7. Then 20, then 9, then 130, then 3, then 140. So that is testing.
Yeah.
Not an event. But all those cases around that might all be one event.
Yeah.
All that 133, 144, 85, whatever, in that 1 week might be attributed to one event. So we can do that. We can look for events in certain areas.
Yeah.
Whenever we see a spike, we do so.
Yeah. We archive, we come up with a database for events and
yes, actually that's what we need, and then we correlate.
Yeah, we correlate with the numbers. Yeah.
Like when was the president in Kisumu?
That is I think that was a Tuesday. I think the last Tuesday.
Tuesday was what date was that?
Let me see if I can.
27th.
Yeah, around 27. Yeah.
So expect cases to go up when? From next Tuesday.
So yeah, we give them 5 to 6 days. So from next Tuesday, if they do some tests,
Wednesday, yeah.
Yes, we'll have a surge in the number of cases.
Yeah.
Yeah.
Yep. And then BOMAS BVI was when? Monday.
BVI was Monday. Okay. Yeah, I think it was Monday. Then the president went to Kisumu. Yeah.
Yeah. So anyway, so you get the point. I think.
Yeah.
If we start to get those.
Sure, that's something we can do.
We can.
Yeah. All right. Yes. Welcome to.
Thank you.
Yeah.
Good evening, Dr. Ayah, John.
Hey, hi, Yaz. How are you? I almost called you
fine.
a day or two ago.
You called me?
I almost called you.
Oh, okay. I'm sorry for joining in late. I totally forgot. I just remembered last minute. I've been hearing. Actually, the discussion is really interesting, especially the one for the political campaigns and the COVID-19, like establishing a relationship.
Yeah.
That would be interesting because when I saw those pictures, I'd also thought about it in some way, and it was kind of discouraging as well. Yeah.
This has been happening for a while. Yes, I think we have had 2 to 3 months of massive political campaigns. Yeah.
Yeah, it's actually, it would be interesting. Maybe I can assist John in working out the numbers.
Sure.
Yeah.
Actually,
that would be very nice. Yeah.
Actually, we can do a database for the events that have happened in the last 2 to 3 months. On the other side, we have a database on the COVID-19 cases, and then we can correlate. Yeah, someone is doing the numbers. That's Samantha.
The numbers are there already. Yeah.
Yeah.
Okay. Yeah. That would be that would be really good. Yeah. Sure, I can help out on that.
Yeah. Maybe we can do that in the coming week. We see what we'll have by Thursday or Friday, because today we decided to have a catch-up call just to review on the trends. Yeah.
Okay. Yeah. Thanks. I haven't joined the call in a while, but at least now I'm more available, so I'd be joining more frequently.
Okay. You're welcome.
Are you done with school? Are you done with school?
I know. Actually, apparently, like the strike has also stopped all the online classes. Yeah, so we don't have. I think right now the only active school members are the final year students. Yeah, they're doing like their exams at the moment. Yeah. So they'll hopefully join now the workforce soon. Yeah.
Yeah, it's gonna be a bit of a struggle though.
I don't know if they've got internship placements as yet. Yeah, but it would be interesting. I was even thinking, like, even having a note of their experiences, because it would even yield in some really good data. Like, that's if they join.
Or when they finally join.
Yeah. Because I've been seeing, like, it's quite interesting in especially European countries when the finalists joined, there was a lot of data being collected about their experience, starting their career in COVID-19 and everything. Yeah, like it helps to elucidate gaps in like educational gaps and other things. Yeah. So that would also be interesting. Yeah.
Okay. Right. So the other thing. So this is basically a second wave. So the question is whether our country, that is Kenya, prepared enough for a second wave. Okay, during the first wave, you see the government moved into to equip or to have different counties set aside, for example, 300 at least 300 bed capacity for isolation of COVID-19 cases. So some counties moved in to set up ICUs, increase their bed capacity. So the question is, what is that capacity as we stand? So that is, I think, something else we need to take stock of. So for the last 7 months, what capacity have we achieved, so that we can say we are much more prepared for an upcoming wave than before. I think that would be another interesting area that we need to look at. What is the health system capacity 7-8 months after the pandemic, or since the first case was reported in Kenya? Yeah.
But
John.
on
Yes, Dr. Ayah?
no, carry on. No, just carry on.
Yeah, can I say something? It's
Just
because
yeah.
John, by doing that, I would suggest that could we project like the way you used in that Excel sheet to try to project according to what we have by next month. But by this, if the situation continue like this, by the end of the month, because that the prediction, the forecasting one works very well once the infection rates starts to increase, because we are in the beginning of the increasing curve. Once we are in the beginning of the increasing curve, it is when the predictions work very well, and also it can give us an idea on how to prepare, how the country could be prepared in terms of bed capacities.
Yeah, the projections will be one way to look at it, to see what we expect in a month time based on what we have had in the last 2-3 months. So the other question is, Dr. Ayah, so how can we do that? How can we take stock of the capacity so far that has been, for example, let's say increased by the government at the national level and at the county level?
I mean, you're doing I mean, they've had the reports, eh?
Yeah.
But remember, a lot of them were fake, eh? Remember that report?
The reports from the ministry?
From the governors. When they had one of the governors' conference, it turned out that a lot of these things were fake, eh?
Ah.
They didn't actually put in any capacity.
Oh, okay.
Yeah, and then we have this thing of private sector crying that they're full, eh?
Mm-hmm.
And you know they're full because they have resumed business, so they are admitting people for other issues.
Yeah.
So their capacity they had put us, they had started saying there was no more COVID, so they started turning over more beds towards
general
the usual
patients
stuff.
Mm-hmm. Yeah.
Yes.
Mm-hmm.
Yeah. So so it's not that the public hospitals are still not full.
Mm-hmm.
Yeah. But the private ones are full. And so the story there is going to be that you see, COVID insurance is not paying, eh?
Mm-hmm.
Yeah. So you don't want COVID patients. Yeah. But now it's going to interfere with business again. The same way for a private hospital, it's the same way like for a restaurant. Is the hotel services will suffer.
Yeah.
If they have to turn over more patients. Yeah, that's why they are crying.
Mm-hmm.
I just had some questions or thoughts. Among the factors
Mm-hmm.
that determine a second wave arising or a second wave coming, of course, was reopening. Reopening was one of the major one, but why it was really emphasized, let's say, in those European or American regions is also the weather, because of the winter approaching. Was also another factor, because of course COVID is like a flu, so it's associated with cold. Yeah. So that was one of the factor, which we don't have this factor. If you were to bring it,
but we do. Temperatures have dropped.
Yeah, but you're approaching
this October, the rains.
The hot months, like the November and December.
In November.
Yeah. Oh, it
climate change aside.
November.
Climate change aside, remember nowadays October is the second rainiest month in the year.
Okay, yeah. So, but and then also like the testing, the number of testing, the fact that we are maybe not doing adequate testing, does that also help us understand if we're still not getting into the, or we might be in the second wave, but we don't know.
Yeah.
I think we didn't even finish the first wave. I think it was just one continuous thing. And what we didn't do, we stopped testing in September.
Yeah, you said testing almost stopped. Because at some point, I think we tested in September, I think at some point we had only 400 tests.
Yeah. It stopped testing.
And then question, can the testing be influenced by politics?
Of course.
Yeah.
But there's no way to bring that out in form of evidence, or
you can't prove it. Yeah, you can't prove it.
Actually, Dr. Ayah, I have come across a study trying to show the relationship between policies, information, behavior, and the outcome in terms of COVID-19 cases. So it's part of what I'm working on.
Oh, that's a nice one.
Yeah, with regard to the masks. Yeah. So what Yas is asking is actually something that is there's a conceptual framework that shows that when people get information that COVID-19 cases have reduced, for example, the government announces that we are doing well, we are flattening the curve, people tend to disregard social distancing measures, and they tend to do away with masks, they tend to resume their normal businesses. So you see now that is information influencing the behavior, which can be tracked by, for example, the Google mobility reports, and that was done in the United States.
Yes.
Yeah, so when government reports the country is doing well, people tend to disregard the measures, the political campaigns resume, and you tend now to have a resurgence on the cases. Actually, it's they are very interesting papers explaining that relationship. Yeah.
No, that would be interesting. But I think, Yas, you're asking whether we can also deliberately stop testing.
Yes, or like if not stop testing, but like the numbers that are being reported to us is somehow politically influenced. Of course, because like as they carry out their rallies or campaigns, they don't want it to also be they don't all that effort to go waste by a number of cases, because then the whole public will turn against them. So of course they have to influence those numbers, but of course if you want to bring it out now in form of writing or stuff, you have to have some strong, I don't know if I could say evidence or some strong correlation. So that was my question, like is there a way like to
that one is very tough. We don't have we don't have an independent enough civil service or people who are brave enough to say, you politician, you're the cause of this thing.
Yeah. Because if it comes out from me, it will be like an opinion or like a thought, but it won't be something that is influential. Yeah.
And Mwema mentioned that France is in a lockdown because of a second wave.
Yeah,
it's like the second wave has hit them harder. Mwema, was that the case?
Yes, yes. The country is in a total lockdown. There's no flights, international flights and or local flights. People are not allowed to travel, and they are in the local down like the way it was before. So they have to observe the restriction measure up to 1 month. That's what the president say, and then they will evaluate how the situation will be for them to reopen. But they are in a lockdown right now.
Well, maybe if you can do a case study for France, that would really, like, how did they get to the second lockdown? Yeah,
Yeah,
maybe
yes,
was
yes.
there was there like what we are witnessing in Kenya after the reopening? Now people disregarded the measures. Maybe you can find two articles explaining the how this came about.
No,
That
for
would be interesting. Yeah.
yes, I will try to find the paper. What might be the correlation between between them because they were doing well compared to
Mm-hmm.
compare even to USA, because from them, yes, they have lifted the restriction measure, but they were still observing. They have less activity where people have to go to manifest, the manifestations of people, politicians, or the bargaining with the community, the police, compared to USA.
Yeah.
But that one, I'll try to figure out what might be the reason, but we cannot associate that for the political one, because in USA, yes, we can say it's a political one because they are in a campaign right now. But in France, they have less those kind of activity where the community have to go to the have to interact with the police or have to manifest. They had not that kind of situation, so we will need to find to figure out what might be the reason.
Maybe this is explaining how the
Yes,
basically how the trend has progressed or has turned out to be in France.
yeah,
Yeah. Yeah.
yes.
Anyways, that would be interesting. If you do find it, just please let us know so that we can have a discussion. Yeah. So we start winding up. Uh, today we were trying to do, it was a catch-up call, just trying to review on the trends in Kenya. Because it's like we are going back to where we started. Now um, the the reopening of KMTC that was supposed, I think, to happen on Monday will not be happening because of the rising number of COVID-19 cases. So any other institution, for example, that is intended to be reopened, so these decisions might be revisited. Yeah, so let's see what we can write about in from next week, so that we keep informing the members of the public on the blog and also the healthcare providers. Yeah, so as we conclude, anything else you like to say, Yaaser? Anything else? Any closing remark on your side? Okay, so I think we have come to the end of the call. So a few things that have come up in the call, we'll do a write-up on the turnaround time for testing and the point of testing. Then we'll have to do a database on the events that have happened in the last 2 to 3 months, and we will try to correlate that with the COVID-19 database, COVID-19 numbers. Then Mwema maybe will help us to look at the France as a case study, a scientific paper or two, or a commentary that's talking about the turnaround of the COVID-19 situation in France, just to help us understand, for example, in that situation, how the second wave came about. Yeah, and also Mwema will also try to find someone from DRC who could be able to write with us or to have a discussion with us with regard to COVID-19, or also with regard to Ebola situation. Yeah. So we didn't. I had informed Samantha to join us in the call today, but she didn't. I don't know why she didn't manage to join us. Hopefully, she'll join us in the next call so that we can look at the database. She has been doing a good job on the COVID-19 numbers and in terms of the cases and the deaths. Yeah. So I think we can end the call now. Dr. Ayah, in a closing remark as we call it off.
No, I'm good. I'm happy we've had the call. So I think if we can work on that a bit more.
Yeah.
I really don't believe that there's a second wave. I think we never hit below the 5% margin. The WHO definition of having reduced this thing.
Yeah.
So to me, we're still in the same
wave.
Yeah. So we're just continuing. And then the other thing to think about, somebody called me today to tell me that, you better start preparing. My bishop in Shags wants to visit in December. And I pointed out to him it's 6 weeks away, and I don't think we're going to have a Christmas. People are still in the normal sort of whatever, thinking that we're going to go away. Already schools, the CS has announced that there won't be a holiday.
Yeah.
And I think that is deliberate in order to start to signal to people that, usually schools close in early December.
Yeah.
And then people begin to migrate. Now, can you imagine people migrating?
Yeah, that will be
disaster.
Worsen the situation. Yeah.
Yeah. So I think even as we think about the article, not for this week, but maybe for next week, we need to do some. What will Christmas look like?
Okay. Yeah.
So that's where we should be projecting to.
Yeah.
Okay.
All right. Yeah. Thank you very much.
That's all. Thanks. Thank you very much, guys.
All right.
Have a good weekend. Yeah.
Thank you very much. I'll follow up with John to catch up and